Okay, so what we want to talk about today is we're going to talk about actually a customer story that we have in France, a customer who is using HealthShares as a navigation, an orchestrator of different services that are, some services are from InterSystems and some others are from a third-party application, and how we basically use HealthShares, how we integrate this third part using everything that we have in HealthShares in terms of authentication and authorization. So the French customer we're going to talk about is actually a region in Mayenne. So it's a small region in Mayenne. It's about 300,000 patient population, and we provided HealthShares as for the 7 hospitals. So it's really the main goal is to do a coordination between the primary care providers and the care providers that are in the hospitals. So really build that bridge basically between the care provider in the city and the care provider within the hospitals. So they have different objectives. So really the first, coordination between hospitals and the city, like I said. The second one is to simplify also complex care pathway. And by that, I mean discharge, complex discharge that can happen, so that you need the coordination as well with the city, care provider in the city and nurses in the city at home also. And the third part is to analyze the population. So that's really their main objectives in terms of using HealthShares. So now, how this project started is really because they really had that need in that region to build this coordination, this relationship between all the different care providers caring for the same patient. And how we did it. So we basically did co-build it. So meaning that we had some different meetings initially with third parties. So we had we were part of the meeting. We had private practitioners, so really the GPs and different nurses in the cities also were involved in these initial meetings. The hospitals also. And with all together, basically in the same room, we came up with a specification, the project itself. And so basically that ended up in 3 months. We built that, and in July we started a prototype with a few GPs and a few specialties within the GHT, which is GHT is a group of hospitals in Mayenne, 7 hospitals. So what we did is using HealthShares as a foundation. So really using HealthShares as a one-stop shop for all the different services that you can provide for the care providers. So this is a really single entry point for the different care professionals. We handle everything about security, authentication, authorization, and Francois is going to talk about that after. Consent, patient consent, and of course interoperability is a huge part also, to aggregate all the different data coming from the different hospitals. And the third part, integration, which was new, and you're going to see a demo on how it's working. So the idea is really to make it really transparent, seamless for the user, so that when he he log on to the platform, then he can access the different services, no matter from where it is, if it's InterSystems, if it's something else. In terms of services that you have, we had some referral coming from the GP, so that the GP can make some referral for hospitalization, request for care, and then in the hospital, there are some nurses in charge of coordination, and basically they handle the triage, those requests, and then there's a communication that is enabled now between the GP and the hospital to coordinate basically the care for this patient. Telehealth This is also a partner that we involved in this project. They provide telehealth for the cities. And this, in that case, it's telehealth between the specialists in the hospital and GPs in the city. Pharmacy module, we have, I'm not going to go into too much detail, but you see like medical record summary. There's some discussion areas, so it's really communication, allowing communication between different specialists. Notification, of course, so the GP is notified that a patient, his patient is the death of his patient in the hospitals. Also when he's been admitted in the hospital, when he's been discharged. So that's a really great value for the GP on this project. Now we're going to talk about how we did with authentication, authorization, and how we use a single sign-on with all the different care providers, depending on where you are, in the city, in the hospitals, all that.
Okay, so I'm going to talk about the authentication and authorization process. And if you know a little bit about HealthShare, there's been a few changes in the last few years. And what used to be just the iris login and password is now more of a whole ecosystem of applications. And we really talk about a navigation app with multiple applications. And also, in terms of authentication, we use the HealthShare user registry and enable sharing authentication with other providers. In fact, for this project and for a bunch of others, we see more and more that instead of just maintaining a user table in our solution, users just want to leverage existing platforms, existing solutions for authentication because they already have user accounts, they already have systems. Sometimes, like on the first one at the top, Pro Santé Connect, you have a national system that is available to provide identification of healthcare providers. And it's not just a directory, actually. It is a full OAuth, OpenID Connect stack that you can leverage so that if you have your professional ID, like the CPS at the top, or even just an app, and you have the electronic version of the same card, you can use that to log in to any application. And so that's what we did on this project. We leveraged Pro Santé Connect platform so that you can just log in with that third-party national provider into HealthShare. Alternatively, the care providers in the hospital, they also have their systems already, right? They also have their computers, and they have a login, they have an Active Directory where they have all their users, and they don't want to have to maintain another table. Completely understandable. So what we did as well is to integrate with Active Directory, meaning that you could just, on the HealthShare platform, use the login and password from the Active Directory, or even better, we have this thing called integrated Windows authentication, meaning that when a user logs into Windows, that's it, you're done. You can open your browser and you're directly authenticated to your application. I can give more details about this if you want, but this is a very neat process where we actually skip any other login than the OS login when you start your day. The last one, and of course we maintain this too, is a basic login and password accessibility that's mostly for users that don't fall into these categories. And there's users like delegated staff, secretaries, but also professional staff like nurses, emergency access transportation staff that would not have any of these services available or available yet, for which we provide another mechanism. The beauty of HealthShare is that we're capable of integrating all these separate mechanisms for authentication and integrate them seamlessly into HealthShare. And yeah. And of course, once you do this, there's a very, very complex authorization matrix that you have to put together, because who has access to see what patients, under what conditions, when, and depending on their user profile as well, right? So it's not because you fall into this one categories that you all of a sudden just have one profile. Sometimes it's still going to be a little bit more complicated, or you're going to have to assert that the patient had a relationship with you or gave this consent, his or her consent to you. So you may end up with some complex table like this, and you see there's a bunch of O's and N's. O's are for yes in French, and for no. And you have even some of those stars because, yeah, it's no, but maybe yes, but it depends. You know, there's a little bit more conditions. So, of course, you have to implement this HealthShare, but still, it's actually fairly simple, and we have a fully supported process to do this. So, in summary, just to sort of take us a little bit out of this, this nice user case and user story, the whole point we wanted to bring with this presentation is that HealthShare doesn't have to be this black box where you have to go through all the hoops of, you know, managing your users there, managing the application that we provide. You can actually do much more than that. And on the left, you would have providers of identity for the users, and we can completely pull all this user context right into HealthShare navigation app. And on the right, we can also propagate these to third-party applications. And the example for Mayenne, you have a bunch of third-party applications. They are embedded into our navigation app, so they're just, you know, other tabs on the left side menu that you can click on, and you're going to open a third-party app. And we pass to these apps an OAuth context, if you're using OAuth, but it could be another standard like SAML or whatever. And we can even pass patient context. So you could load these apps directly with the patient context that you are using right now. So this really takes us, you know, far from just thinking of HealthShare as a monolithic application, but rather like a real orchestrator of services, applications, you know, authentication mechanism, as well as patient-centric applications. And now the demo.
Yeah. So now you're going to see how basically the different authentication in the demo. So you're going to see the three type of authentication that we did for this project in real, how this works, if that works. Okay, so the first part is going to be the OAuth connection. So here, what you can see is a GP, for example, is going to connect to the national, basically, care provider directory with his application that he has on the phone. So he just needs to basically enter the code. And then he enters in the environment with the navigation app that you can see on the left with the different services that he can access. This one is not InterSystems one, it's a third-party application, well integrated so that it doesn't have to re-enter his login. This is all set and all the different privileges are handled as well once you log on. Here you see the aggregated view of the patient in HealthShare, the different type of data that they collect in this type of project. Now, the second thing you're going to see is how you can log on with the Active Directory. So it's used by care professional in the hospital, and then same thing. Pretty much you see a different environment. And the third one, finally, is just a login password, and it's used by mostly what we call the delegated user. So it's a GP who says, I want a nurse, for example, or another doctor to have access to the same patient that I do, to do the things in my name. So that's how we did it.
And I don't know if you noticed, but these three different user personas have slightly different profiles, and you could hide some of the applications on the left so that some of them have access to some of the features and not others, right? It's not just the authentication.
Yeah, that's right. And that's it. So I don't know if you have any questions.
Yeah. Many. Yes. Yes, please.
Still trying to understand what magic you did in the HealthShare, because my
Yeah.
understanding, just by looking at your presentation, is you can have a different source of the connections coming from the national provider,
Yes.
from
Yes.
the AD, whatever.
Mm-hmm.
So how do you kind of, what's your intake process? How do you have like a services running
So
in the
it's
HealthShare to look at
so
all this? Or?
yeah. So it's an interesting story because, like I said before, we used to have just username and password, and now HealthShare has right out of the box a OAuth server. So what we're doing is we're cascading all of these mechanisms into our OAuth server, meaning that you connect with the first OAuth provider, that's the national service, and we're an OAuth client to that provider. But once we've connected and come back to our website, we pass on those credentials to our OAuth server as if you were a local user, and we retrieve all the metadata, from the OAuth tokens and everything, so we can map this to our profiles, define what access rights they have, and then just display whatever profile. If it was a username and password, it would just work, right out of the box. For LDAP, it's also, again, in the backend, the OAuth server would have a way to know that when you select one of these domains, it has to pass credentials through an LDAP service in that particular case. One thing we don't show, and I talked about this a little bit, the integrated Windows authentication. It's another thing that is a little different, where it works with Apache that is set up as a Kerberos service. And if you know anything about Windows services, they work a lot with Kerberos, and that's how the browser can actually, reach out to the Windows Active Directory, pass your credentials via the browser, and Apache will pass this on to HealthShare, to our OAuth server, to retrieve credentials, metadata, etc. So really the idea is that our OAuth server has the flexibility of connecting to a bunch of different providers and delegate its own authentication mechanism to these multiple options.